the government on the lack of funding for joint surgeries for my local orthopedic department, the St. Thomas Elgin General Hospital. Currently, the orthopedic department in my riding is giving up OR times due to the lack of funding from the Ministry of Health and Long-Term Care. It's very frustrating when OR times are available with an outstanding team of doctors, nurses, and staff, support staff available to perform the work. Unfortunately, they're unable to schedule any joint replacement surgeries for half of February and all of March due to a lack of funding from this government. The government here is hiding the fact that they're unable to provide adequate health care services due to a lack of funding, and it can be directly linked to the mismanagement of our financial dollars in our province. Mr. Speaker, the current funding allows for 174 joint replacement surgeries a year. However, that is not enough. They would need funding to at least cover 220 replacement years during the fiscal year. What we're seeing here, we have an award-winning hospital in St. Thomas, Ontario, winning awards for the wait times. However, they are being restricted on the number of joint replacements they can do. Why would you penalize a hospital when, in fact, they are exceeding expectations? Mr. Speaker, currently, patients are waiting 4 or 5 months just for the surgery, and due to this lack of funding, it's being pushed further down the road. OR times will continue to be cancelled until the start of a new fiscal year. Mr. Speaker, I call upon the government to quit eroding our health care services, get your financial house in order, and fund adequate health care services for my riding. Thank you, Speaker.
Thank you. Member statements. The member from Windsor.